Hello everybody, we're back here again. Vinny and myself just wanted to give you a second update on the corona craziness epidemic that we're dealing with. So we've had such a great response to the first video. We've had several questions that have been prompted as a result of that video. We just wanted to address some of those questions that some of you have asked, and I'll try to cover as much material as I can and try to put you a little bit more at ease about the corona craziness that we're currently dealing with. So just to start off, we had a little funny episode. Somebody on Facebook thought that I was the Dr. Drew Pinsky, the MTV sex therapy doctor. So I just want to let you guys know I'm not that Dr. Drew. I like to say I'm the real Dr. Drew, but I am in the healthcare field. I've been either studying the human body, anatomy, physiology, science, or practicing healthcare and chiropractic care and wellness for well over 35 years combined. So we've been able to help thousands and thousands of people, get people off of medication, get them healthy, just help them to have a better quality life and express the real individual that God created them to be. So once again, I'm here, the real Dr. Drew, and of course we have the real Vinny. Vinny, you want to say hi? Vinny, look. You want to say hi? All right. So everybody gives shouts out to Vinny. Everybody gives shouts out to me. I just want to say I appreciate all the love and good response that we've gotten from some of my hometown people back in Millville, New Jersey. Just give a shout out to class of 1982, Millville High School. Love you guys, appreciate you guys, and some of the best people you'll ever meet in the world coming from that South Jersey area. Some of my alumni from USF here in Tampa, and of course alumni from Life Chiropractic College in Marietta, Georgia. Some of the greatest chiropractors in the world coming out of Life Chiropractic College. And if you're not under chiropractic care, get under chiropractic care. One of the best ways that you can boost your immune system is through a chiropractic spinal adjustment. So just wanted to cover that a little bit, and let's go ahead and get started. So here we go. So as far as the virus itself, the SARS-CoV-2 virus, we call it, the coronavirus is the disease, once again, nicknamed COVID-19 for year 2019. The virus hasn't changed. It's still the same. It's still affecting the elderly, the immunosuppressed, or the immunocompromised. It still likes those people that have what we call comorbidity, underlying health problems. Heart disease is number one. If you have congestive heart failure in the last stages of your life, think about an 80-year-old person that has a bad heart. Their heart's going downhill. They're not very strong health-wise. Their immune system is suppressed. Because this virus acts like a pneumonia virus, it likes the heart and lungs. It tends to affect those people the most. So diabetes is next. But again, think of an 80-year-old with diabetes. They weren't just diagnosed with diabetes the last year or so. They probably had adult onset diabetes, type 2 diabetes, mellitus. Probably had that for 30, 40, 50 years, and it's taking a toll on their body. It's destroying their kidneys, destroying their heart, destroying the blood vessels in their body. It's just wreaking havoc on the body as a whole. Maybe they have sores in their body, or ulcerations or cuts that don't want to heal up because they have poor circulation. That's what they're talking about when they talk about diabetes, and not somebody that has borderline blood sugar, diabetic. So any underlying respiratory illness, and of course high blood pressure, and of course cancer. In that order, those are the most dangerous individuals that are more susceptible to getting infected by the virus. Can anyone else get infected with the virus? Absolutely. As far as numbers go, what we're seeing, it appears that the numbers here are kind of leveling off a little bit. We had a little bit of a spike where the numbers jumped up, but now the numbers are settling off a little bit. So maybe, hopefully, we've had our spike in the numbers that we're going to see. Are we probably going to see more cases? Hey, stop. Are we going to see more cases? Absolutely. Are we going to see more deaths? Absolutely. There are still people who are infected in their 70s, 80s, 90s who are fighting to stay alive, basically. So those people will definitely be in a fight for their lives. So we'll probably see some increased numbers. We'll probably see some increased cases. But you look at what's happening worldwide, and by far China has the most number of cases and the most number of deaths, in the 4,000 range. Outside of Asia, outside of China and Asia, Italy is number one as far as the top number of deaths besides China. And they're at like about 800 range, 827 was the last number that I saw. So the statistics show that if you're 80 years old, and you get this virus, that you're gonna have a tough time. That's the average age of death. So I don't like to talk doom and gloom. We want to talk positivity here and health and wellness. You also have to look at the numbers. We always say figures don't lie, liars figure. That person that's always saying, oh, the way I figure it, it's like, no, it doesn't matter how you figure it. It's what the numbers, what the data, what the statistics say. So basically, when you look at this thing, what we want to really focus on here, what's happening to us in America, in the States, what's happening in your city, in your state. I have up behind me from the CDC a map of the U.S. It's backwards because of the way I have the cell phone on the selfie view. So it looks like a different country, but that's our country back there. And when you look at that map, you can go on the CDC website and you can see all the same information that I look at. And they have the most accurate data, the most accurate numbers. There's no conspiracy. They're not holding back. They're not lying to you. Their numbers come directly from health institutions, hospitals, and things. So there's no, covering anything up and hiding and lying to the American people. That's the fact right there. So when you look at that map, you can see on there the states that are darker in color, darker red in color, are states that have shown more cases of coronavirus. So you can look at your state. There's probably 5 or 6 states on here: Alabama, Mississippi, West Virginia, what's that one up there? Maine, North Dakota, Montana, or Idaho. These states are showing no cases. So we've had roughly in that 800 range of cases reported. The news media, again, they're going to tell you it's over 1,000. It's multiplying out of control. It's spiraling. Last I learned in math, when you multiply something, if you multiply something by 2, it doubles, right? So if we have, yesterday we have 750 cases. If you multiply it by 2, it's multiplying. It's doubling. Now today we may have 1,500 cases. The next day we may have 3,000 cases. Well, that's not happening. We're seeing, it makes a headline. 1 new case in Florida, 1 new case in, somebody in Washington, D.C. Now somebody's got it in Washington, D.C. They're shutting down Washington, D.C. because, we don't want anything to happen there. So if 1 case pops up, it makes headlines, it makes news, that's rating. I remember when I first saw the press conference that Trump gave and at the White House, and they had a CDC representative there. They had the Secretary of Health and Human Services. They had the Surgeon General. All the people that are overseeing this, all the people that are in charge, and they just talked about the same things we've been talking about. It's just treat it like another virus. Treat it like a cold or a flu virus. Keep your hands clean. Avoid people who are coughing and sneezing. If you've been in places where you've been in close contact with people, then just be careful. What you touch, who you touch. Stay sanitary. Those kinds of things. And I watched the press conference. It was just common sense kinds of things. And then I turn the channel after the press conference is over, and here's a network that already has somebody on their program, just putting fear into people. Oh, the White House has no plan for this. Oh, they don't know what they're doing. They're not doing anything. They just have no idea what they're doing. This is going to get worse. By a month or two, we could have half of our population infected. This is going to get out of control. It's just fear mongering, putting fear into people, and it's just unnecessary. So basically what we want to do is continue just to educate people and keep people calm as far as what we know we can do as individuals. People talk about what's happening in Italy and things like that. I don't have any control over what happens in Italy. You don't have control over that. Basically, you have control over your person and your environment, your house, where you go and what you do. So basically, we've had some questions, and we'll address some of these. What can you do yourself? What can I do myself to make sure I don't get this thing, right? So again, just remember the demographic, the population that this virus seems to like are the elderly. I'm not going to mention any numbers, but if you think you're elderly, then don't take any chances, take extra precautions. I always say if you're going to err on the side of caution, be more cautious than not. So basically, if you're in the elderly population and you don't have any of those underlying illnesses, the heart disease, the high blood pressure, the diabetes, respiratory illnesses, or the cancer, if you don't have any of those, chances are you have a pretty good immune system. Think of it, how many times a year do you get a cold? How many times a year do you get the flu? If you haven't had the flu in years and you haven't had a cold in a couple of years, you have a good immune system. So chances of you contracting this coronavirus are very slim. So if you do come in contact with somebody, there's, of course, you're going to have a risk of contracting the coronavirus. And of course, the same symptoms, be alert and be aware of the symptoms: the dry cough, the difficulty breathing, the high fever, the sore throat. If your fever goes from normal to 102, 103 degrees overnight, then, you might be a little bit concerned. But basically, the same things we talked about. Wash your hands. Keep your hands clean. We always say, washy, washy, happy, happy. Washy, washy, happy, happy. Keep those hands clean. Think about all the places your hands go, and what we're doing with our hands. We're touching doorknobs. We're handling money. That dirty money. There's viruses get spread, so much through money. If anybody has any dirty money out there, and you're not sure if it has a virus on it, infected, put it in an envelope, mail it to me. I'll dispose of it for you, okay? So I'll give you my address. You can mail all your dirty money to me. I'll take it, I'll burn it, I'll get rid of it, okay? So send me your dirty money. All right, so what else can I do? Besides, I always like pulling up to when you pull up to a red light, traffic light, and I like looking around and see what everybody's doing in their cars. It's amazing what you see, and you look at what people are doing with their hands. You got this guy over here, he's eating his Big Mac, and he's licking his fingers, and the sauce is running down his arms. He's got his hands in his mouth and all that. You got another person over here, they're biting their nails, and this guy over here, he's digging away in his nose. I don't know what he's digging for gold or whatever. But you think about that, those people that you don't see what they're doing in their car, then they come to see you, and hey, Joe, how's it doing? You're shaking hands, and it's just be wary of that, and keep your hands sanitized, keep your hands clean. For you ladies out there, I know when I go into a public restroom, I talk about this all the time with my wife. Go into a public restroom, we're at a restaurant, and you see guys coming in and leaving without washing their hands, taking care of business, leaving without washing their hands. And I would say, just from the numbers that I see, it's probably 50-50. 50-50. Half the guys are washing their hands, half the guys aren't. Half the guys that are washing their hands, they're not always using soap. They're not, maybe giving a quick rinse to look good and, dry it off with a paper towel. So ladies, just know that when they come back to your table and they're trying to be all romantic and they're, oh, honey, you got an eyelash on your face, and they're putting their hands on your face, and, next thing you know, they're running their fingers through your hair and trying to, be all seductive and all this stuff. And, and then they're hand feeding you the French fries, and you're like, eating the fries and licking their fingers. And, all right, maybe too much information. So anyway, don't eat the fries. Step away from the fries. So just remember that, encourage the people that the people in your family, the people around you, encourage them to wash their hands, keep their hands clean. I remember when our kids were younger, were little, my wife, she would always, did you wash your hands? You wash your hands? Where you were at? I didn't hear the water running. She even says to me, I didn't hear the water running. You didn't wash your hands. Your hearing's going. What are you talking about? So, but she would smell their hands. Let me smell your hands. I'm like, what are you smelling for? And she's like, smelling for soap. Oh, okay, all right, that makes sense. So, use that soap, washy washy, happy happy, sing the happy birthday song, happy birthday to you, sing your ABCs or whatever, sing God Bless America, YMCA. It doesn't matter what song you sing, just wash those hands, use hot water and soap. That'll do the job with sanitizing for your hands. Sanitize your countertops, your desktop, your workstation, the armrests on your chairs, anything that gets touched. Use a little alcohol solution, not beer. Don't use beer. I saw something on the internet where people were using vodka don't waste a good beer on sanitizing your countertop. Drink your beer, be happy. Don't use that. We're talking like, isopropyl alcohol, rubbing alcohol, 70% or greater alcohol solution, but a little bleach, mix with a little water, diluted bleach. That's another good way. Lysol sprays, the disinfectant wipes, all these things, so those are all good ways to make sure that you're keeping your area clean. Think of it like paint. If when you're out, you're painting your walls in your house, and you get paint on your hands, and then next thing you know, you look down, the paint's on your pants, and you look in the mirror and there's paint on your nose. Like, how did I get paint on my nose, and paint on your ear, and paint in your hair? It's like everything that you touch, if there's virus or bacteria on your hand, which I guarantee you right now, there are viruses and bacteria on your hands. So basically, any of those bacteria on your hands, you can possibly transfer them. But again, you have an immune system, keep your immune system strong. They think with this virus, it has a 5-day incubation period minimum. 5-day minimum, which means from the time that you get infected with the virus to the time you test positive for the virus or maybe show symptoms, there's a 5-day incubation period. So you could be walking around thinking everything's fine, and all of a sudden you wake up and you have the symptoms. So, and then there are some other studies coming out of China that they're saying they're seeing maybe even up to a 24-day incubation period. So when you hear about people being quarantined, they're encouraging self-quarantining. You want to self-quarantine, that's why they're saying a minimum of like 14 days. That's kind of in the midline. You're feeling good after 15 days. Probably most likely cases, you got a good immune system, you're going to be okay. So people ask me about wearing masks. Is a mask going to help me? No, a mask is going to help you. Masks are designed to prevent people from infecting you. So think about when you go in for surgery, the doctor's wearing a mask. He's not going to spread germs on you when you're cut wide open because he doesn't want to infect your body. So the masks don't generally protect you from that. It's basically what's on your hands, then you're touching your face, it's going up through your nose, going into your respiratory system, into your lungs. Is there a vaccine? They're working on possibly a vaccine, but again, we talked about the last time, this is a SARS virus. They don't have a vaccine from the SARS virus in 2002, 2003, so it would be months or even years before they develop a vaccine for this virus. So at this point, no. But the best thing to do is to keep your immune system boosted up, keep your body clean. How many times have I touched my face in this video? Have you noticed I'm kind of deliberately kind of touching my face? They say the average person touches their face 3 to 5 times a minute. So if you think about that, that's like what, 300 times an hour you're touching your face. And if you do that, that's, you know, a few thousand times a day you're touching your face. So if there's stuff on your hands, you're touching your nose, touching your face, digging for gold or whatever you're doing, you're going to get stuff up inside your body. So keep those hands clean. I sanitize my hands, you know, between the patients that I see. I wash my hands. We'll go to a restaurant for lunch. I'll wash my hands before I leave. I get there, I look at the menu, I'm touching the menu, the table, whatever. I place my order, I go to the restroom, wash my hands again, make sure, get my food, eat my food, come back to the office, wash my hands again before I see anybody. So we have travel warnings, and this is a big one, you know, that everybody's panicking about the travel warnings. So right now, of course, we have the government issuing travel warnings for China, Iran, South Korea, Italy. So I don't know about you, but right now, maybe not China, not the best place to go. Iran, not on the top of my bucket list for vacation destinations. South Korea, beautiful country, but again, you're in that Asia continent. Might be a little risky right now. Italy, of course, Italy is pretty much on lockdown right now. You know, but again, with warmer weather and changing in the knowledge that we have, understanding what we're dealing with, you'll see those numbers come down. So people ask me, well, you know, what happened in Italy? Why is it, you know, why did the numbers go up so fast? Basically, one of the main explanations that I can give and what I believe is just the overall general health conditions and clean living conditions that will change what happens in a population. You know, we watched this show on TV the other night, and they were somewhere in Nigeria, and they go into the shower, and there's a bucket on the floor in the shower. They don't have running water in the house. There's a bucket on the floor, and that's where they go to the bathroom, in the bucket. They take the bucket outside, throw it out in the street. They have another bucket for their shower. You know, they dip a cup in there. They you know, soap up and dip a cup in the bucket and rinse off with the water, and that's how they take their shower. So you go out in the street, and there's, you know, all kinds of open raw sewage in the street, in ditches, and the roads aren't paved, and who knows how clean the water is. So basically, in those type of living conditions, your immune system is already struggling to keep you healthy. So if now your immune system gets a little bit more of a virus to deal with, it's going to be working overtime. So that's why in those types of conditions, you know, here in America, we have running water, we have indoor plumbing, we have soap, you know. So remember 7th, 8th grade healthcare class, you know, they taught you how to, you know, use deodorant every day, take a shower every day, brush your teeth. You know, we had PE back then, and you know, 7th, 8th grade PE, you know, nobody wanted to take a shower after PE. You're all sweating us. But, you know, they would fail you in our PE classes if you didn't take a shower. So you go out, you sweat. You're not going to go back and sit in your classroom all sweaty and dirty and, you know, be a health risk to anybody. So they would encourage you to shower. So just remember that every day. You know, take a hot shower every day. Soap up, you know, lather up, sing your songs, do your dance, whatever you do in the shower. You know, do that every day, and you'll be happy. Change your clothes, wash your clothes every day. I see some people wearing the same clothes day after day after day, and you don't know what you're carrying around on your clothes. So wash those clothes. You know, maybe wear them once, wash them, get rid of them. I know we go on these cruises, and you know, they have the signs in the bathroom where they want you to, they encourage you to use your towel throughout the duration of the cruise. Use the same towel to dry off. And I'm thinking to myself, probably not. I don't think so. You know, I dried myself off yesterday with this part of the towel. I don't know what part of the towel I used to dry my, you know, my stuff off with. And, you know, I'm not going to dry my face off with those areas, right? Kind of makes sense to me. So cleanliness is next to godliness. That's what I was always taught. So I'm just saying, you know, be clean, be hygienic, practice good hygiene, those simple basic healthcare things. Keep your nails clean, keep your hands clean, so forth and so on. Watch what you're touching everywhere you go. You know, it's the doorknobs, the handrails, these places. People ask me about, like, you know, say cruise ships and things of that nature. Well, why, you know, it's a contained environment. And what's going to happen on a cruise ship if one person, you know, like you have this cruise recently, somebody came from Hong Kong, China, and got on the ship, and next thing you know, there's somebody getting infected with coronavirus. So what are they going to do? They're going to quarantine the whole ship because they don't know how many people have been infected. So they're going to keep that ship off in sea, at sea for, you know, 14 days or so until they figure out, you know, what they're going to do. Then they're going to bring those people in. Here in the United States, they're going to go to local healthcare agencies where they will either be quarantined for a couple more weeks or they'll be monitored in a healthcare facility. So, you know, we're dealing with this pretty good. Hopefully the numbers have kind of leveled off. There's still a little bit of panic out there. I was in the supermarket line yesterday and I saw this Globe magazine and said, "Coronavirus destroying the world." And it's like they're showing, you know, 300 cases in this country, 200 cases in this country, you know, 100 cases. Like, that's destroying the world? I mean, you know, so the World Health Organization came out and declared this a pandemic. A pandemic. What does the word pandemic mean? Pandemic means worldwide, basically, or wide range. So you think of the word pandemonium, wide range fear, right? So pandemic, if there was one case that was found of the coronavirus in every country in the world, that would be a pandemic, even though it's only one case, because it's spread worldwide. Has nothing to do with the numbers. There's still, you know, I don't know, maybe, you know, what, 70,000 or so, 80,000 cases worldwide. So basically 65% of those, the last number I read, 65% of those were from China. And, you know, those people are, you know, the majority of those have recovered. Greater than 60% have recovered. And that's why that death rate is, you know, in the 4,000 number range. So basically, as far as numbers go, I guess 111 countries have been affected by or showing cases of the coronavirus. So just know your numbers, know your facts. Go to that CDC website, cdc.gov. That's the website that I kind of use. You know, I was talking to somebody last night, and this guy was, you know, he's in his 60s. He travels a lot, and you know, he does cruises and things. And he's telling me, "Oh yeah, I heard if you're 80 years old and you get this, you have an 85% chance of dying." It's like, you know, I'm like, where are you getting your numbers from? I haven't seen any numbers like that. And I'm thinking, you know, okay, you're an air traffic controller by trade, and you know, I get these people that come and they argue with me with numbers and statistics. It's like, you know, they come in, they want to argue, and I'm like, well, what do you do for a living? They're like, oh, you know, I sell insurance. I'm like, well, okay, if I want boat insurance, I'll call you. You know, you're the expert in that area. You know, what do you do? Oh, I'm a mechanic. Okay, if my car breaks down, I'll you know, I'll hit you up, right? You know, if I need some help with the car. And what do you do? And, oh, I'm a hairstylist. Like, you know, okay. Stay in your lane, bro. Stay in your lane, right? So look at the numbers, look at the facts, know the numbers. At this point, there's still no reason to fear. You know, there's still no reason to panic. We have a pretty good grasp on this. It's going to spread by that direct virus contact. It's not floating around in the air. You breathe the air, you're not going to get infected. That's not how it works. These viruses, it's not a hover virus. It doesn't hover around in the air and you know, attack people in midair. Somebody coughs, they cough some virus out onto a countertop, onto a doorknob. They wipe their mouth, they cough in their hand, they touch that doorknob, you touch the doorknob. That's how it's going to get contracted and spread around. So hopefully we covered everything. Vinny, you want to give a shout out to anybody? Vinny, want to give a shout out to Shep. Vinny loves himself some live PD. You like Shep? Is Shep on TV? Shep? Is Shep on TV? Yeah. He's got some good friends. He's got Elfie and Ollie and Sophie. You want to shout out to anybody, Vin, before we go? Okay. All right. So hopefully this thing is on its decline, and here in America, it's looking okay right now, pretty good. But don't buy into the fear, don't buy into the pandemonium, and hopefully, we'll come out of this thing okay. Keep that immune system. One last thing, there is something that I take, I mentioned before, but vitamin C is one of the best things for your immune system. B complex, great source of energy. Eat your green leafy vegetables, eat your spinach, eat your broccoli, eat your kale, eat your super greens. I take a super green drink for breakfast every morning. It has 15 servings of fruits and veggies and green foods, 59 different superfoods. So to eat those berries, eat the fresh fruit, eat the whole foods. But I do take something, periodically, sporadically. It's called Po de Arco. It's a bark from a tree in South America, an inner bark from a tree. So you take it in pill supplement formula. They make tea out of it. It's a concentrated tea that you can drink. But it has antiviral properties, antibiotic properties. I think it's a cancer fighter, yeast, parasites, fungus. Anytime I feel a little, not quite myself, I feel something coming on, maybe your scratchy throat, maybe a little achy, upset stomach, and anything like that, I pop a bunch of this Po de Arco. It's PAUDARCO. You can look it up. It's on the internet. You can get it at your local health food store. It's really good thing that I take. You don't want to take it every day because you lose the effectiveness of it, but it's something that you can take maybe once a week or every 4 or 5 days. Pop a few of those pills. Keep that stuff in your system, periodically, and that's something that I take myself personally. I think it has great properties for keeping your immune system strong. But again, there's other things on the market. There's all kinds of healthcare products on the market, all kinds of supplements that you can take naturally to naturally boost the immune system. That's the best way to do it. There's a lot of medications that people may take that may suppress their immune system. So just remember that. Get your exercise, get outside, get your fresh air, avoid the smoking and, the stress and the things that bring your immune system down. So, okay, thanks a lot, and we'll talk to you soon. Have a good day.